Good afternoon, all you moms and dads out there. It's me, Teixeira Murray. I am a mom blogger from Mama Is Me, and I'm so honored this afternoon to be chatting to a very cool lady, Dr. Carmen, who will be chatting to us about general health in children and how we should be dealing with cold and keeping our little ones' immune systems really strong. So Dr. Carmen did have a live happening yesterday, but due to some technical difficulties, she couldn't continue. So I'm very excited that I'd get to chat to somebody that I admire myself as a mom and as a doctor. So I'm very excited to be chatting to her today. So Dr. Carmen, if you are ready for me, I'd be happy to include you. Okay, I see you are waving at me, and I just want to say hi to everybody again for joining in. While I wait for Dr. Carmen, please don't forget to send all your questions through. We'd love to answer them for you. As a mom myself, I've got two little ones. I am very concerned about how I need to make sure that my little ones have strong immune systems, especially during winter. And to add to that, it is also a pandemic that we're facing, which is COVID. So I'm going to be adding a Dr. Carmen right now so that she can help me with all my queries, and I'm sure she will be able to answer many of your concerns that you might have. Also, our little ones have been summoned to go back to school, so we are as more concerned now than ever before. Hi, Dr. Carmen.
Hello.
How are you?
Fine, and you?
You're looking so beautiful.
Oh, thanks. Thank you.
Yeah. And I'm so excited to be chatting to you this afternoon. We chat often. I always inbox you because I've got so many concerns and so many things that run through my head as a mother. So I'm so excited that we get to chat today about things that I believe a lot of moms and dads out there are concerned about, and that is the immune system of our little ones. But yesterday you started, so this is almost in a way part two of the conversation. And so I'd like for you, if you don't mind, just to start from the beginning in as far as who you are and what makes you an expert on this topic. I know you are an expert, but in case somebody else who hadn't joined us yesterday, so just tell us a little bit more about who you are.
Yeah, so basically I'm a GP. I've been a GP for almost 15 years now. I've worked mostly in emergency medicine, dealing with emergencies as well as cold cases. We tend to see a bit of both. And then I also have a master's in public health. So I'm very passionate about health education and, preventing injury and disease. So that's essentially why I started blogging, in order to kind of give parents advice about how to keep the little ones healthy, how to keep them safe, and so that so that essentially they don't end up at the doctors. So that's actually why I do what I do. I'm also a mom. I have a almost 4-year-old, and yeah, she inspires me every day.
There's nothing like having your own little ones to make you want to improve your craft. And I'm speaking from a teacher's perspective. I think only once I became a mother, I wanted to learn more about education, and I wanted to make sure that I was on top of my game. And I suppose that's the same for you as a GP, as a doctor. And obviously that's where your passion lies. And tell me a little bit about how having your daughter, Erin, how that has made you a little bit more sort of like aware of children's immune systems.
I suppose we've had our fair share of colds and flus, and Erin herself, she's got enlarged adenoids and tonsils. So, if those become very swollen, then we have sleepless nights. So I am quite passionate about keeping her immune system in check, trying to avoid her getting sick, because her lack of sleep impacts my lack of sleep. That's, yeah.
System. So obviously a happy child, happy mom, happy dad, happy family. So yeah. So that brings me to the topic at hand today. And that's the immune system of our little ones. And cold, it's getting cold. We at the beginning or the onset of winter, and a lot of us have many concerns as to how we are going to make sure our little ones stay strong, their immune systems stay strong during winter. So just off the bat, what is sort of the first thing that we need to put in our minds when it comes to little ones and winter?
Sure. It's quite broad, but in terms of the most important thing really is just ensuring that your child has a healthy diet. I know with younger kids, it's easy, making sure that they get in all their veggies and fruits and that, but really having a balanced diet is the most important thing to get all your vitamins and your minerals and nutrients for your immune system properly. I think that for me is the number one. And then obviously, you know, when they are ill, keeping them at home, allowing them to rest, allowing them to recover, you know, or not exposing them to other members of the family that are ill, you know, just taking those kind of preemptive measures, and just like protecting them from getting sick any way that you can.
So, you know, it's been lockdown, and I think we in like 65, 70 days or more of having been at home. And correct me if I'm wrong, but I kind of felt like for the first time in forever, it's like nobody in my house is sick. None of us have like coughs or sneezes. I mean, that's a good thing. Obviously, we COVID safe, but I'm saying it just dawned upon me that actually keeping our little ones away from sort of, I suppose, you know, you can't always control it, but actually having social distanced ourselves has actually kept our immune systems strong. Am I imagining this?
Well, not strong. It's just prevented you from getting sick. So germs make you sick. You know, I like to tell people that it's not the cold. The cold doesn't make wet hair doesn't make you sick. It's germs. So you need to come into contact with those germs in order to catch them and then become sick. So the mere fact that we've been staying indoors means that we've had no exposure to germs. So there's been no, you know, human to human jumping. Is what you see with normal colds and flus and that kind of thing. So that's why we're also healthy. But now, as the lockdown, you know, eases and we're going out, people are going back to work, the kids are going to be going back to school, we are going to be coming face to face with various other viruses and bacteria, and we are going to get sick again. It's inevitable. That's just how it works. You know, so it's been very nice now, but the bubble is going to pop.
And that's, I think, the concern that I've had, and this is the question I had asked you I inboxed you, because I'm going to be very honest and say that I had personally never gone for the flu vaccine before, and I think I took my kids once or twice or whatever the case may be, but now it has become sort of something I felt like I needed to do, especially like you say, we are now going to be exposing ourselves to that. Is that a good way of strengthening our immune system for what's about to happen in as far as exposure?
So when you get a vaccine, you allow your immune system to develop antibodies towards that particular virus or bacteria. So you get the flu vaccine, your body's going to make antibodies towards the flu vaccine, so that if you do come across the flu vaccine, like, you know, jumps into your face, so to speak, body will already have the defense mechanisms to prevent infection. Not always 100%, because remember there's quite a few strains of flu, and the vaccine has a limited number, so it's going to prevent infection from the bad ones, which is what we don't want. So in terms, it does make your immune system stronger, in a sense that you've got a memory towards that infection, so that you don't actually get the full-blown disease. That's how that works.
So you would agree then with me that it is an important vaccine to get now?
Yes. I've said from the very beginning that the flu vaccine is the best vaccine to get actually every year. It's a seasonal vaccine because the flu virus mutates. So every year we're dealing with a different strain. So it's really important to get that updated vaccine every year so that you don't get a bad flu infection. And especially for the little kids, I like to say, I say everybody needs to get the flu vaccine. But in South Africa, they only recommend for kids under 3 and then elderly patients 65. So that, and people who've got, like diabetes or have other conditions that make them vulnerable to a severe infection. There's another reason why now more than ever, I really emphasize that people get the flu vaccine because we are dealing with COVID. The symptoms of coronavirus, COVID-19 and the flu are quite similar. If you've had a flu vaccine, then the chances are that you most probably, and you're developing those symptoms, then you can kind of, and you're going to see your doctor and you tell them, well, I've had the flu vaccine, and the doctor will be more alert to the fact that you might be having COVID as opposed to, influenza. And also getting the flu vaccine, if a lot of people got the flu vaccine, then it actually would, reduce admissions to hospitals with like flu-related complications. So like flu pneumonias and things like that. Won't see that as much, so that they can still deal with the coronavirus cases.
That makes so much sense. We have a question here, Dr. Carmen. It says, if you are allergic to the vaccine, so I suppose the flu vaccine, what is an alternative? And that question is from Dash.
Yeah. So to be allergic to the vaccine, you're allergic to a component of the vaccine.
Okay.
It would be some kind of like the preservative or how the vaccine was grown in the lab. A lot of people have an allergy to eggs per se, and then they would have an issue with the flu vaccine, in which case they do like they test it out, and then they will have to then see, under the doctor. So it's given under doctor supervision, and then the patient stays in the rooms, and you monitor to see whether there's some kind of a reaction. Flu vaccine allergy is not that common, but as far as I know, there's another alternative, and I'm not sure. Well, not all the pharmacies offer it. For children, they do give a nasal alternative of the injectable. Okay. Intranasal. It's not that readily available, and there's also another form, because there's a couple of pharmaceutical companies that make the flu vaccine. So if you might be allergic to the one component of the one vaccine, but you could tolerate the other one. So it's just a matter of discussing it with your pediatrician or your GP to see what's the right vaccine for you. But as I say, being allergic to the flu vaccine, it's not very common.
So we've got another question here from Tom Svab. She says, she asks rather, can you get the flu vaccine while you're breastfeeding?
Yes, you get the flu. You must get the flu vaccine when you're pregnant and while you're breastfeeding. Because remember, newborns, infants in particular, they've got very, very weak immune systems. So they rely on the mother's antibodies. And that is the whole purpose of breastfeeding, right? It's because you are expressing your antibodies into the breast milk. And that, in essence, that's why you are offering your babies protection. So when you get the flu vaccine, mom's going to make antibodies. And those antibodies are going to pass through the milk into the baby. And that's going to protect the baby for the first few months of birth.
Oh, that's amazing. That's so good to know, especially, concerning lots of moms are worried about the kinds of meds they take while breastfeeding. So that's very good. Thank you for that. What about exercise? I am somebody that loves to exercise. I exercise every single day, and my children seem to enjoy, exercising and being active as much as I do. Has this helped them or their immune system? So what's the role of exercise in as far as building strong immunes?
Well, exercise is part and parcel. Eating healthy and exercise is part and parcel healthy overall. I think actually now with the lockdown, a lot of people have become a little less active, which has made not eating as well. We've maybe put on a little bit of weight, and our kids have. I know Erin's also put on some weight in the last couple of weeks, which I've noticed a lot. Yeah, so you have to be a bit, now that they're not running around to the jungle gyms, the parties and that, you have to be a bit more proactive about making sure that they're exercise. And I mentioned to Terry yesterday that there actually are some 24-hour movement guidelines in South Africa, which are in keeping with the WHO recommendations, which basically in line with, you know, limited screen time. So they want to keep the kids active to keep them healthy. So according to age groups, they make certain recommendations, but overall, I think from about 3, they say that kids should exercise for 3 hours a day. And
Wow.
of that, but you know, when I say exercise, it's not, you know, partaking in a sport for 3 hours a day.
Yeah.
Like running around, climbing up a jungle gym, you know, going up and down the stairs, like any kind of movement, you know, just not sedentary. But of those 3 hours, they should have 1 hour of sustained, like moderate to vigorous exercise, which increases their heart rate. So they're even from 3, I think it's from 3, yeah. They're recommending that.
I'm definitely going to check that out. My children, so we do about 3 times a week. We get outside and actually go on the road and go for a walk. And my 3-year-old, because I've also got a 3-year-old, she is like loving it. She just loves to run, and you know, she goes for it. We do about 3 or 5 Ks, and she wants to do the whole, you know, 3 5. And I was actually concerned that, oh, what if this is too much for her? You know, what if this is too much? I mean, she's alive and she's fine, so I guess it's within line.
They'll tell you, you know, she'll say her little legs are sore, or she's had enough, she's tired. So you don't have to worry about that. But, you know, as long as they are getting out there, they're getting exercise, they're increasing their heart rate, which is really good for the heart muscle and for heart and the lung health, then that's fine.
Well, that's good to know, because I was getting worried. Also, it's getting so cold. We've been out, and there was a week, I think it was 2 weeks ago, that was so cold that we actually couldn't bear being outside. How does that impact exercise? I mean, should we just put more layers on, or, you know, is it like, you know, acclimatize?
Well, yeah, I mean, in Europe, when it gets really cold, people are still walking to work. They don't, you know, people walk and they go mountain climbing, they go, you know, like hiking, they still go out in the cold. It's something we are, I suppose we're a bit spoiled in
We
South Africa.
are. We
Always
stay.
walk.
Yeah.
Yeah, it's cold, we hide inside. But, you know, pack on the layers and go for a walk. And once you start going for a walk, your body temperature increases anyway, and you don't really feel the cold as much.
And I suppose
So,
that's
yeah.
for your joints anyway, you know, to just stay active and keep that blood
Yeah.
circulating anyway.
Yeah. The
You know,
little
another.
kids have like fun activities in the house as well that
Yeah.
keep them, you know, moving.
Yeah, I actually think it's so good to go out despite the weather, you know, just to explore the different senses of winter. You know, from seeing the different seasons changing and all of that. I think it's very important. Another thing about winter, though, and I'm noticing this with my children, is the dry skin. You know, dry skin is something that I struggle with as well. And then in winter, it just becomes that much more aggravated, if you will. So how do we manage dryness? You know, dryness of the skin, and, you know, tips for those with sensitive skins.
So moist. That's all, you know, particularly is really, really dry. We're dry generally. It's not a humid city. And in winter, when it's cold, it's more dry. It means there's no water in the air. So the water that is in your skin actually evaporates quicker, you know, homeostasis. So that's why we actually feel very dry and tight in winter. So I like to, like with Erin, my favorite brand, I mean, I use it. I don't like to punt brands per se, but I love Epimax. You can get any other aqueous cream and you use that. You moisturize in the morning, you moisturize at night. If you feel you need to moisturize like in the afternoon, that's, you know, also fine. One thing that I can recommend is that when you looking for a moisturizer, you should probably not choose a lotion because that's more water-based and that tends to dry out the skin. So you should go for like a cream or like an ointment, like something thick that's going to really, you know, penetrate into the skin and keep you moist. You mentioned something like sensitive skin as well. Yeah, so I avoid all products with perfumes. So shower gels, or like no perfume, the creams, no perfume. Just keep it, you know, as simple as possible, especially on the young kids. And you can also use the aqueous cream even to bath, you know, to use it as a soap It's also very, yeah.
Yeah, I actually love to do that, and my kids actually like it. I think it for them it's like all luxurious when I like lather them with the aqueous cream. So yeah, that's a good tip as well. I wanted to find out from you though, with eczema. I mean, is it something that I find that my son's eczema gets aggravated in winter? Is that because of the drop in temperature, or is it something else?
Probably the dryness. So
Okay.
eczema, it needs to really, really be managed, you know, treated. You've got to keep it moist so that it doesn't, you know, dry out and flake.
Yeah, I hear you. Okay, and the same ritual with the, you know, the thick aqueous will actually help that.
Yeah, obviously you get certain
Yeah.
of eczema, you know, and then dermatologists will prescribe other cortisone-based things, and you know, but I'm just talking about simple measures that you can do without, you know, having to lead to something prescription-based. Yeah.
We've got a question here from Dewdrop15. She's asking, what about coconut oil? What are your thoughts on coconut?
Yes, coconut oil is great. You can even add that to the aqueous cream and massage that in.
Okay, no, that's fantastic because I love coconut oil as well. Talking about coconut oil and sort of super products, I know you've mentioned diet, and I know you've said that it's very important to have a good balanced diet, but is there a specific sort of like superfood or vitamin that we can add to our little ones' diets that will help them?
Gosh, I like.
No, it's a loaded question.
Yeah, I mean the list of superfoods is like never ending. It's essentially every single vegetable and fruit you can think of. But in terms of getting the important nutrients and things that you need, you know, like vitamin C, vitamin A, all the vitamins really play such an important role in the immune system. There isn't just like one in particular. But your citrus fruits are really, really good. Spinach, broccoli, even like red peppers. Red peppers have got like so much vitamin C in them. People wouldn't never guess.
Wow.
Yeah, but I'm not a dietitian, so I just try and keep it really balanced at home, and yeah.
I mean, obviously, I think, like you say, keeping away from sugars, keeping away from white products, white bread, and that kind of thing, is things that I've sort of implemented as a mom here anyway. So
that's about eating clean. If you're eating clean, your body will be clean, and that is something that's so important. I know it's it's great in theory, but sometimes it's not easy to implement in practice. But once you into that routine and that habit, and you start to really enjoy vegetables and enjoy cooking with them and experimenting with them and hiding them in your kids' meals, then you'll see the benefits, definitely.
So I mean, one of the ways to actually get him to cook. So he's really into, you know, MasterChef Kids or Junior or stuff like that. He's 6 years old. So now I've got him to actually participate by cooking. So now he takes the vegetables and he chops it. And that's helped a lot. And, you know, with my daughter, like you say, we do a lot of sneaky things, like add cauliflower to pasta or that kind of stuff, just to make sure that they get in all the nutrients. And especially because during COVID, we spent a lot of time baking. I mean, I'm going to admit that I've done a lot of baking. And so it's become kind of a norm. And now I'm trying to sort of retrain them that we need to eat healthier. So, yeah.
Absolutely.
Can you still hear me? I've missed you there.
No, I can hear you. I lost you a little bit.
Okay, no, great. I was just checking that it's not a problem. So, again, we spoke about, you know, it's that time of, well, COVID has happened. We're in an epidemic, and now the sort of Department of Education has opened schools. How do we tackle that in as far as taking care of our little ones, sending them to school? I personally have a 6-year-old and a 3-year-old, and I'm not ready to send my 3-year-old. And, you know, I know a lot of people out there say that the kids are sort of less likely to, catch corona or COVID-19. Just talk to me a little bit about that. Help me with easing my mind.
All like early research so far is showing that children are not big spreaders of the virus. So they can get infected, but they don't get very sick, which means that their viral loads are low. I don't want to complicate things, but that the viral load is low, so they can't then, transmit it to somebody else as readily as somebody older can. Okay. So that's finding, and that's why they are, a lot of scientists are supporting that kids go back to school, because they're not going to be spreading it. They're not going to catch it from the other kids and bring it into your home as readily as we thought originally. So from that side, I think it's, I support the fact that kids can go back to school. But personally, I am keeping Erin at home just a little bit longer, purely because I don't want her to go and get colds and flus. I'm not particularly worried because it is winter now, and it's inevitable. So that's why I make the choice to keep her at home until maybe end of August. But I think it's perfectly okay for kids to go back to school, as long as the schools, the schools have to be practicing better. They're keeping the classes smaller. They're going to try, it's going to be very difficult with the ages to keep social distancing. I don't know about face masks on the younger kids, making them kids 3, 4, and 5, having them wear face masks all day at school. I'm really not on board for that. I think it'll be quite difficult for them. But if they just keep a clean environment, and the kids as well, they wash their hands, they cough and sneeze into their elbows, and that's the parents' role. The parents need to be teaching the kids this at home, so that they're at school.
And I find what you're saying so interesting in as far as little ones not wearing these masks. I find that, even when we go for a walk, my daughter, as I mentioned, is 3, my son is 6. My 6-year-old kind of wears his mask for the duration of the walk, which I also think maybe I'm not doing it right. Maybe they shouldn't be wearing a mask while going on a jog. But the point is that my little ones are finding it so difficult to just keep this thing, and they're complaining about breathing and etc., etc. But I do know that schools have gone out of their way to try and make sure, well, many schools at least have gone out of their way to make sure that it's hygienic and that everybody is, keeping their space, and they've separated, that kind of thing. However, if parents do send their kids to school and they have any sort of suspicion, what are the things or signs that need to look out for in their little ones? And I'm saying little ones, but it could be a 6 or 7 or 8-year-old.
A suspicion that the child might have coronavirus.
So if they have sent them for a good couple of weeks and they're just sort of worried that their overall sort of health looks suspicious, what are the things they need to look out for?
Yeah, so basically, if the child is coming home, and even yourself as an adult, you come back from work and you're starting to feel a bit fluish, you're presenting with a fever, you're having a bit of a little bit of a cough, a dryish cough. The thing with coronavirus, you can even be asymptomatic, so that's also, it's very difficult to say. But if you suspect anything, if your child is just not themselves, you're just noticing that they are under the weather, it is advisable. They are advising that kiddies then go and be tested, that we all go and be tested. Then you are able, once you have that result, you are able then to isolate at home. And that is the whole point, is that if you're feeling ill, you go for a test and you stay away from others, that you don't spread it. And the same goes for kids. If you're seeing that your child is, exhibiting some signs or some flu-like symptoms, because the symptoms are actually really similar to the flu. So, then it's advisable to take your child to the doctor to be checked out, get the test done, and then, knowing what to do afterwards, obviously isolate. And that brings me to another question.
how do we know what's the difference? And in my case, I'm asking this because in our house, we sort of like suffer a lot from allergies, sinuses. So what's the difference between a cold, a flu, and actually just having allergies?
So allergies are mostly like sinus allergies. It's mostly like in your head and up here, and those can't tend to be like they go on for a long time. So
Yeah.
you'll have allergies. Now you've had a cold that's just never ending.
Yeah.
The eyes and a runny nose, and that's kind of the symptoms, most common symptoms of allergies. The colds, kind of similarly, you've got a blocked nose, stuffy head, also might have itchy eyes, and then those symptoms also start off kind of slowly, but it doesn't go on as long as an allergy. I like to think of it that anything from the neck up,
Okay.
cold, anything
Okay.
from the neck down is the flu. So like if your body, yeah. So if your body is feeling sore, you're tired, you've got a bit of, you're coughing, then it's the flu. Basically how I kind of like explain it. Comparing, I think coronavirus and the flu, because those symptoms are really very similar. Both can present with fever, but the main difference, I think, which is important between the two, is that COVID-19 often causes chest problems.
Okay.
Have the shortness of breath, which is much more common compared to the flu. Whereas if you've got shortness of breath with the flu, you've actually got now complicated flu. So in the early stage, it was something like that compared to, to COVID, where you've got that from the beginning.
So that brings me to a question in as far as, what if your little one has asthma or a respiratory sort of illness already? Is that sort of like an alarm bell to say, hold on, keep him at home or keep her at home because of the fact that they're so similar in symptoms?
Yeah, so children who've got asthma, so they have said that if you have got well-controlled asthma, that you are not at any higher risk of a severe infection with COVID. That they've said. However, a risk is a risk. Okay, so anyone who's got some kind of a lung pathology or a comorbidity is at risk of a severe form of coronavirus, because it affects the lungs. It's just a symptom. So, like children, for example, with cystic fibrosis, they might end up with really bad COVID infection. So yeah, you have to be a bit more wary. So when your child with asthma, with some other lung pathology is presenting with symptoms of shortness of breath or whatever, then you really need to act a bit quickly. Not quickly, but you need to the doctor, have that looked at and assessed to see whether this is coronavirus or not. So I think, those kiddies that are at higher risk of severe infection, the parents need to be a bit more alert and aware of the symptoms.
Wow, thank you, Dr. Carmen. I mean, I've got another question that sort of relates to allergies. When you have allergies, is it okay to give an antihistamine on a sort of more chronic basis to help curb that?
Yeah, I don't give antihistamines to young kiddies, because of so you give an antihistamine if somebody's having a acute allergic reaction, then yes, you can give an antihistamine, but to use them long term is really not recommended. So like in some adults, we pop this, the Sinumax and whatever long term. But you get different generations of antihistamines, and I'm not going to go into because I can be here for like a whole day. Some which are not recommended at all, for more than like 4 days, 5 days, and you get others that you can take more on a chronic basis. And then also, from only from about 5 years of age. So it really is, it's more it's has to be based on the patient themselves. But yeah.
Okay, so that's definitely something I need to do more research on.
Yeah, complicates things a bit more for you. Sorry.
No, not at all, but it's something that I believe I should research, and that's always a good thing, to go and find the answers, the answers. So I know that you've said that you were all for kids going back to school. So you are feeling okay with how the restrictions have been lifted. It's causing me a little bit of anxiety to think that we're going to go out there, people going to work, schools, and sort of normality, but it will, or rather, let me say, how will it impact us? Sort of very brief on, looking at it.
Yeah, so the main reason behind the lockdown initially was to get the healthcare system organized and get them ready to prepare them. Unfortunately, we cannot hide behind our walls forever, and this virus is not going to go anywhere anytime soon, because we don't have a vaccine, and we're not going to get a vaccine anytime soon either, because vaccine development takes a long time. And this is something to realize, is that this is just a fact based on other things. But we need to go out there. Some of us are going to get the virus, and that's fine. Majority of people who get it do fine. Some are even sick. Okay, it's the minority who have got other underlying conditions that are doing badly. Okay, so but the majority of the population seems to be doing okay worldwide, and we see this across the world, that this has been the case. It's important for us to go out though and be exposed so that we can build up some herd immunity. And I'm sure a lot of people would have heard about this whole herd immunity, is that we need people in the community who are immune to this virus, so that so you actually are then creating a distance. I don't know, like without drawing it for you, a distance. So you've got someone who's been infected, now he's got the antibodies, and here's someone who has the infection, and then next to them here is somebody who is non-immune, who has not had it. Okay, so this virus would jump this person, but this person's had the infection already, so this person's not going to be sick, so that this person then will not infect that person.
Okay, makes loads of sense.
So we are, in essence, herd immunity protects people. So we need to have it done. And that's like how a vaccine works, essentially, as well. Yeah.
So in many ways, we have to go out there and learn to live responsibly with the virus.
Exactly. Responsibly. That's a great way to put it. We need to live responsibly, around this time. And just, work through this, because we will come out of this. It's not the first pandemic that that we've seen as humans, when we've survived many others before. So we will get through this.
I love what you say, we've survived many others before, and that brings me to the point where I love reading your medical history sort of snit.
I love it.
Yes, no, I love it too, because I mean, this is actually it. We are making history, and in many ways we are in a better position than when it was the Black Plague, because of technology, and so we are able to be better and do better this time round. And I hope that we do as a nation, as a humanity, that we actually just go out there and live responsibly with this. And I know that we will be fine. I know that we will see the end of this eventually. And then we can write about it in our history books.
Of course.
Yes. We lived through 2020.
Their children, that they were kids during this pandemic.
Yeah. So that's one way of looking at it, the cup half full. We're making history. Dr. Carmen, it was so awesome chatting to you. Our time has run out. I mean, I honestly can sit and chat to you all day. You are a wealth of information, and that's what I love about you. You're not afraid to share that information, and that is why I love your page. I love your blog posts, because you share so much and you empower me. the mom. So thank you so much for that. I know there must be many people that have many questions for you. So any last closing words that you want to sort of share with everybody?
Sure. I don't know. Yeah, I guess everyone must just stay optimistic and, you know, look to the future in a positive way. And let's just, as I read somewhere in an article somewhere, that we need to dial down the fear, you know.
Yeah.
So let's dial down the fear and
Hold.
yeah,
Helped
and
us do.
hmm?
Empowering us with information, we are able to dial down that fear. So thank you for sharing that information with us today. You've been awesome, and
Thank
I
you
appreciate it so much. Thank you.
me, and you
It's
must have
been.
a
Thank you. Bye bye. So there you have it, moms and dads. Thank you so much to Dr. Carmen, who is such a wealth of information, that has been so gracious enough to share her time with us today and sort of just help us get through some of the questions that we may find ourselves battling with on a daily basis as parents. If you have any more questions, please do not hesitate to drop us a message, and we will pass them on to Dr. Carmen. You can also go and check out her page, Mom Doc. She is an amazing source of information. She shares so much about COVID. She shares so much about pediatrics, and I'm sure she will be able to answer many of your questions. As for myself, thank you so much for joining us this afternoon. If you don't know who I am, I'm Teixeira Murray. Please catch me on Teixeira Murray on Instagram, as well as my Facebook page, which is Mama Is Me. It has been so awesome to chat to you today. Please be safe, please be responsible, and have a great weekend. Mama Magic will have lots more live content for you next week, so please be sure to check out the Mama Magic page. They will be chatting about what it is you need to have in your hospital bag. So that's something to look forward to. Have a good day and a great weekend. Bye.